In Washington state, the dream of a stable home is shattering for far too many. This isn't just about statistics. It's about families, individuals, our neighbors, caught in a crisis that's growing at an alarming pace. The numbers paint a stark picture of a statewide emergency. Washington has one of the nation's highest rates of homelessness, ranking behind only California and New York in total population, yet with a disproportionately high number of unsheltered individuals. According to the 2024 point-in-time count, 151,040 people experienced homelessness on a single night in January. This represents a significant 26% increase in unsheltered homelessness since 2022 alone. In 2024, a staggering 52.2% of the total homeless population in Washington, or 72,215 people, were unsheltered, living in places not meant for human habitation. And who are these individuals? The face of homelessness in Washington is not monolithic. It's not just a person you might imagine on a street corner. It's working poor families like the Johnsons, a family of four who lost their apartment in Spokane when their building was sold and rent spiked beyond their reach. It's veterans who served our country, now struggling to navigate complex systems, accounting for an estimated 12,684 individuals experiencing homelessness in 2023. It's our youth. Estimates suggest at least 53,000 young people aged 12 to 24 in Washington are experiencing homelessness or unstable housing situations, with youth of color and LGBTQ plus youth disproportionately affected. And it's seniors, a rapidly growing demographic, with thousands of adults aged 55 and older now finding themselves without a stable roof over their heads. The unseen force, why housing is a luxury, not a right. Look at these numbers. It's a stark illustration of a crisis brewing, not just in Washington, but across the nation. On one side, the relentless march of housing costs. On the other, the stalled progress of our paychecks. Housing, once a fundamental need, has become an increasingly unattainable luxury for far too many. The affordable housing meltdown. The core of Washington's burgeoning homeless crisis lies in a fundamental imbalance. A severe lack of affordable housing units, coupled with soaring rental prices that have far outstripped income growth. Between 2010 and 2021, the median rent in Washington state surged by 68.6%, from $774 to $1,305. Over that same period, median household incomes, while increasing, only grew by 57.5%. This gap means that for a significant portion of our population, simply earning a living wage isn't enough to secure a roof over their heads. Consider this. For every 100 low-income renter households in Washington, there are currently only 58 units available that are affordable to them. This isn't just an abstract statistic. It translates to a shortage of over 190,425 low-income housing units across the state. The situation is even more dire for extremely low-income renter households, those earning 30% or less of the area median income. For every 100 of these households, Washington has a mere 28 affordable homes. The consequence? A staggering 75% of these renters are severely housing cost-burdened, spending more than half their income on housing, leaving precious little for food, health care, or transportation. The domino effect, beyond just rent. But the housing crisis isn't a singular force. It's a domino effect, a cascade of interconnected challenges pushing vulnerable individuals and families toward the brink. First, there's the harsh reality of the lack of a living wage. Even for those employed full-time, the minimum wage often falls woefully short of covering basic living expenses, especially housing. When a significant portion of your income is swallowed by rent, one unexpected expense can send your world crashing down. This leads directly to the devastating impact of healthcare costs and medical debt. A sudden illness, an unforeseen accident, or a chronic condition can incur crippling medical bills. A 2020 study of homeless adults in Seattle found that 2/3 reported having medical debt, and nearly a third believed this debt directly contributed to their housing instability. Even small amounts of debt were associated with longer periods of homelessness, with those whose medical debt was sent to collections experiencing, on average, 15.5 years of overall homelessness, compared to 4.4 years for those without such trouble. Shockingly, More than half of these individuals had health insurance at the time they incurred the debt, illustrating how even coverage doesn't guarantee financial security against medical emergencies. Then we address mental health and addiction. While often misconstrued as causes of homelessness, they are frequently exacerbated by the profound stress and trauma of being unhoused. The lack of stable housing, safety, and consistent access to care creates a vicious cycle. Statistics indicate that around one-third of people experiencing homelessness struggle with alcohol and/or drug problems, and approximately two-thirds have lifetime histories of substance use disorders. Furthermore, a 2019 Kitsap County point in time count revealed that 48% of identified homeless individuals cited mental health issues as a cause of their homelessness, and 28% pointed to substance abuse. Without adequate support systems, the streets become a dangerous coping mechanism. Finally, we must acknowledge systemic gaps that leave vulnerable populations exposed. Young people aging out of foster care, without a permanent family or adequate support, are at significantly higher risk. In Washington, 41% of youth who exited foster care at age 18 experienced homelessness or housing instability. While a new law in Washington in 2024 extended the foster care cutoff to age 21, reducing this to 23% for those who participated in extended care, the challenge remains. The criminal justice system also plays a role, with formerly incarcerated individuals facing immense barriers to housing due to their records and lack of resources. People with multiple prior incarcerations are 13 times more likely to experience homelessness than the general population. And tragically, domestic violence remains a leading driver of homelessness, particularly for women and children. In 2012, domestic violence was cited as the largest subpopulation of homeless persons in Washington state. Across multiple studies, over 80% of mothers with children experiencing homelessness had previously endured domestic violence. Homelessness solved? Washington's shocking new plan. Beyond the stark reality of Washington's burgeoning homeless crisis, where the unsheltered population continues to climb, glimmers of hope emerge from dedicated efforts to find lasting solutions. It's not just about addressing the immediate need for shelter. It's about fundamentally rethinking how we approach housing and support. One of the most transformative approaches gaining traction is a housing-first model. This philosophy posits that stable housing is a foundational step for individuals to address other challenges in their lives, such as mental health issues, addiction, or unemployment. Unlike traditional models that often require sobriety or treatment before housing, housing first flips the script. The evidence is compelling. A 2023 study published by the Substance Abuse and Mental Health Services Administration, SAMHSA, found that 85 to 90% of participants in Housing First programs retained housing after 5 years, a significantly higher rate compared to traditional transitional housing. This stability reduces reliance on costly emergency services, with estimates suggesting Housing First programs save taxpayers approximately $20,000 per participant annually by lessening emergency room visits and hospitalizations. Alongside Housing First, homelessness prevention and diversion funds are proving remarkably effective. These programs provide flexible, often one-time financial assistance and tailored support to help individuals and families maintain their existing housing or quickly find alternatives outside the formal homeless response system. In Washington state, the Homelessness Prevention and Diversion Fund, HPDF, launched in 2020 primarily for youth and young adults, has already served over 1,704 households across 10 counties. A report by North Star Advocates highlights its success. 93% of young people who accessed HPDF funds between May 2023 and May 2024 stayed stably housed 1 year later. The average cost per household through HPDF is a mere $2,659, a stark contrast to the $4,318 per household for emergency services, demonstrating its cost-effectiveness. Another innovative, though interim, solution popping up across Washington are tiny home villages and managed encampments. These communities offer individual, lockable units with basic amenities, providing more dignity and safety than traditional congregate shelters. In 2022, nearly 50% of people who exited a tiny house in Seattle/King County moved into permanent housing, a far better outcome than the 14 to 19% exit rate to permanent housing from other emergency shelters. Tiny home villages also boast higher occupancy rates, often around 90%, compared to traditional shelters, which had 23% vacancy in King County in 2021, indicating a strong preference among those experiencing homelessness. They are also relatively cost-effective to establish, with an estimated capital cost of just $15,000 per tiny home for startup. These successes are driven by the heroes among us, dedicated outreach workers, shelter staff, and volunteers from organizations like the Council for the Homeless, Building Changes, and countless local nonprofits. They work tirelessly, often in challenging conditions, to connect individuals with resources and provide compassionate support. However, the path forward is not without its significant hurdles. One of the most persistent is NIMBYism, not in my backyard. Communities often resist the establishment of shelters or affordable housing units due to concerns about property values, safety, or neighborhood aesthetics. This resistance leads to restrictive zoning laws and limited options, perpetuating the cycle of homelessness. Funding also remains a critical challenge. Washington faces projected $403 million funding shortfall for homelessness services in 2024 to 2025, largely due to declining real estate transaction fees that fund these programs. This deficit threatens emergency shelters, rental assistance, and youth homelessness initiatives. Bureaucratic hurdles, staffing shortages due to low pay, and the sheer overwhelming scale of the crisis also hinder progress. Despite these challenges, the innovative solutions and the tireless dedication of many in Washington offer a realistic blueprint for a future where homelessness is no longer an insurmountable crisis, but a solvable challenge. The path forward. We all deserve a place to call home. It's a fundamental human need, yet for thousands in Washington, it remains an elusive dream. This powerful statement, echoing sentiments from countless advocates and individuals with lived experience, encapsulates the urgent call for a clear path forward. The growing homeless crisis in Washington isn't just a statistic. It's a deeply human crisis demanding our collective action. So what can we do? The solution starts with systemic change, primarily through robust policy and advocacy. A critical area is increased funding for affordable housing. Washington State faces a staggering deficit of affordable housing units. In 2023, the median cost per multifamily unit in Washington reached approximately $301,744, and in King County, it soared to around $356,813. Meanwhile, rent continues to climb. According to a 2024 report, the average monthly rent in Washington State was $1,763. This creates a severe cost burden, particularly for low-income households. For instance, in 2024, approximately 77% of extremely low-income renters in Washington were severely cost-burdened, meaning they paid more than half their income toward housing. We need to push for significant, sustained investment in the Washington State Housing Trust Fund and other initiatives that prioritize building and preserving truly affordable homes. Another crucial policy discussion revolves around rent control. While some argue against it, data suggests a different story. A 2024 analysis highlighted that a $100 increase in median rental price was associated with about a 9% increase in the estimated homelessness rate in Washington, and evictions were projected to be up over 34% from 2022 to 2023. Moderate rent stabilization policies, with exemptions for new construction, could provide crucial stability for vulnerable renters, preventing countless families from falling into homelessness due to sudden, unmanageable rent hikes. Beyond housing, we must integrate better mental health and addiction services. The link between behavioral health challenges and homelessness is undeniable. While federal funding for addiction and mental health grants saw abrupt cancellations in early 2025, emphasizing the need for state-level commitment, Washington has mechanisms like the King County Mental Illness and Drug Dependency (MIDD) sales tax, renewed through 2025, which generates around $136 million per biennium for behavioral health services. We need to expand such models statewide and ensure these services are easily accessible, trauma-informed, and culturally competent. Housing first models, which prioritize getting people into stable housing before addressing other issues, have proven highly effective in improving health outcomes and reducing the public costs associated with crisis services. But policy isn't the only answer. Community engagement is vital. You, as an individual, have immense power. Volunteer at your local shelters, food banks, or outreach programs. Organizations like the National Coalition for the Homeless offer directories of local resources and ways to get involved. Donate to reputable nonprofits working on the front lines. Advocacy takes many forms. Write to your legislators, attend town hall meetings, and educate your friends and family. Foster empathy. Remember, homelessness can happen to anyone. Consider Matthew Cate's story from Walla Walla. For over a decade, Matthew was homeless, living in an abandoned rail car. But thanks to a collaborative community approach, including a low-barrier shelter and coordinated services, Matthew recently secured permanent housing after more than 10 years on the streets. Walla Walla County, in fact, found permanent housing for 74% of people who exited its homeless services system in the last fiscal year, nearly twice the state average. Matthew's journey from a makeshift shelter to a stable home is a testament to the power of support and systemic change. The growing homeless crisis in Washington is a shared challenge and therefore a shared responsibility. By advocating for smarter policies, investing in affordable housing, bolstering mental health and addiction services, and actively engaging in our communities, we can build a Washington where every person has a safe, stable place to call home. It's not just an aspiration. It's an achievable future if we act together